Hi, welcome to Channel Nikki. My name is Nikki. I'm a pharmacist, and today's topic is what I wish I knew about pharmacy before I got into it. And a little bit about me. I'm a pharmacist. I've been working for a little over 7 years. I've worked both in retail pharmacies and in hospitals. So, the things about retail pharmacies, such as the big two companies like Walgreens and CVS, a couple of things that I wish I knew about retail pharmacy before I got into it was, well, number one, the hours are long. I would say that's number one for me, because it's not always going to be your typical 9 to 5 job. You can rotate the hours depending on the schedule, but not every day it'll be 9 to 5 or 8 to 4. And I'm talking about retail pharmacy. A lot of these retail pharmacies are open for 14 hours a day. Sometimes they're open for 12 hours. You'll see them open from 7 a.m. and they'll close at 10 p.m. I work at one of the pharmacies in my hometown, and it used to close at midnight. Now they close at 10 p.m. But one of the challenging part of retail pharmacy is that you will sometimes have to come home very late, sometimes at 10 p.m., sometimes at midnight, 9 p.m. I've had a lot of friends tell me pharmacy is a great career for women. Yes, it is. And one of the reasons is that, oh, the hours are great. They get to come home, have kids, they can pick up their kids from school and come home. But that's not always the case. Like I said, a lot of these pharmacies close late at night. So that theory that this is a good field for women just because of the hours, that's not always the case. And also, number two, things about retail is that it's not always gonna be more than one pharmacist working at CVS or Walgreens or Publix. Sometimes you are by yourself. You will have technicians to help you, but sometimes it's only one pharmacist the entire day. I used to have 13-hour shifts at Rite Aid Pharmacy. It's just me by myself. I only had 2 technicians. So sometimes you will see that. It's just you taking on all the challenges, running around, lots of multitasking. It can get a little stressful, but the positive side is that you're helping people, giving people good advice. Pharmacies are like AKA open primary cares. People come to you for help, for guidance, something that they're confused about. You give them good counseling. So, of course, there's positive sides to this. But number three, in retail, you stand up the whole time. If you want to sit down, you can, but you'll probably have to get up the next second because something's always coming up. There's a customer, somebody needs help, there's immunizations you have to give. So that setting, it's just a busy setting in retail. And I wish a lot of these things I kind of knew beforehand, because I used to work full time in retail. And I thought, oh my God, sometimes it gets very tiring and exhausting. So these are just some points to consider. And however, there's positives. This is a great field. Like I said, you're helping people, there's job stability. And so these are some things about retail pharmacies. A lot of students like to work in retail before going into pharmacy school for experience, which is a great way to see the ins and out of a retail pharmacy. All right, now let's talk about hospital, since I also work in a hospital. Hospital pharmacies are very different from retail. You don't talk to the patients on the phone. You don't deal with insurances. You deal with a lot of IV medications because the patient is in a hospital. You're not dealing with only pills or outpatient medicine. So, things about hospital pharmacy. The pharmacy most of the time is located in the basement of the hospital, or sometimes it can be on the second floor or whatever it is. But if you are a staff pharmacist, so I'll get into staff pharmacist versus a clinical pharmacist. Staff pharmacists are usually stuck in the pharmacy the whole day. A clinical pharmacist can go out of the pharmacy. They can go see the patients for counseling. They interact with other interdisciplinary teams, such as the doctors, the nurses, the nurse practitioners, or physician assistants. They can go and do rounds with those teams and go from patient room to patient room. So what I'm saying is a staff pharmacist is sometimes confined to the pharmacy all day, while the clinical pharmacist can actually get out of the pharmacy and walk around and see patients and do a lot of more clinical and hands-on work. So I'm one of those that I don't like to sit in one spot for too long. So for me, being a clinical pharmacist, it is what suits me because I get to get up, go see patients, and talk to people. So those are some things about pharmacies that I wanted to share with you all because I wish I knew all of these before getting into pharmacy school. But right now, I do work in a hospital and I'm happy with what I have. Also, let's talk about how expensive pharmacy schooling can get. Yes, there's student loans out there, and a lot of people say, oh, pharmacy is a great field because it pays well. Yeah, it does pay well, but please consider the taxes and then the student loans. After overcoming those, yes, the take-home money is great, but you do have to work long hours and you do have to work hard. All right, I hope you like my video. Thank you for watching.